Primary Promise, building the nation's model health system for children. Primary Children's Hospital has the only Level IV NICU in the Intermountain West, serving the most fragile newborns from Utah, Idaho, Wyoming, Montana, Nevada, and beyond. A 400,000 square mile service area covering one of the largest geographies of any children's hospital in the nation. We're a unique NICU with no other one like it in this part of the country.
We are really able to take care of kids through the entire continuum of care, from as early as birth until about a year of age. And we are able to provide all surgical subspecialties, and including complicated mechanical devices, and also to take care of kids who have required multiple surgeries and required multiple subspecialty care. It's definitely good for us to see families as they continue to progress in their care and in their development. So we see children that we've sent home with ventilators who come back to us and show us that they no longer need the home ventilator anymore and are running around just being kids.
Day continues to defy odds and be a miracle for sure. She's gotten bigger, her lungs have gotten stronger, her heart has gotten stronger. We are off the vent during the day, we're off oxygen during the day. That just felt like super life-changing for us, and we're really excited for this summer for her to just get to experience more life. After delivery, things got intense very quickly. They discovered some of Day's birth defects, called for life flight, and the next day I entered the NICU doors, and we didn't leave for 9 months. She had 6 life-saving surgeries before we left the NICU. I think we about had 10 nurses on our list of people who would take care of Day over and over. They made all the difference for us. They taught us how to take care of Day. They taught us how to recognize things that Day liked and didn't like. And something that they taught me that has continued to bless our life over and over again as well is they taught me how to advocate.
The doctors at Primary Children's Hospital are incredible. Everything that goes on up there is kind of miraculous. And now she's living this happy life, running around the park. I think she's just going to keep going, honestly. I hope she outlives all of us.
We are so lucky to have a 51-bed, all-private room NICU. Now we have enough space that a parent can spend the night with their baby as many nights as they would like to. And the environment around the baby is just quieter, it's more healing, it's more therapeutic. When you want to reach out to somebody else who's experiencing life in our primary children's NICU, then you have this community space where you can go and meet other families. We also have telecritical care now. That is a camera in each patient's room, and then we have an expert NICU nurse watching each of the patients. We have parent view cameras, which are called angel eye cameras. So when the baby is resting, the family can watch the baby from anywhere in the United States. We're interacting with cardiology, neurosurgery, general surgery, we have physical therapy, we have access to every resource.
Our renovated NICU is a beautiful part of Primary Promise to build the nation's model health system for children, and it's already providing immense benefits, yet much still needs to be accomplished. We have the power to expedite discoveries, to bring groundbreaking treatments into practice, to comfort and heal our youngest, most vulnerable patients. Philanthropy unlocks the door for exceptional medical technologies and outcomes. You can support the emotional needs of our tiniest patients and their families, many of whom are long distances from the comfort of home.
To me, extraordinary care in the NICU is defined by 2 things. It's the clinical excellence, but it's also the service excellence. It's the compassion, the empathy, the listening, the singing to a baby, the holding and rocking, the hug for a mom. It's those 2 things combined that provide extraordinary care.
When it was time for me to go back to work, I decided to go back to the NICU. It's familiar to me. It's what feels like home. In an ICU, you see a lot of really difficult things. And then walking by and out of the corner of your eye, you can see a nurse singing to a baby or playing with them or reading them a story. And it just brings the humanity back into that little baby's life.
Babies who transition out of the NICU may never know the heroic efforts made on their behalf, but their families will never forget. They will remember our NICU as a place where miracles happen, miracles made possible by the vision and compassion of our generous donors.